are you?
Good.
Good. I'm Samantha. I'm going to be your nurse practitioner today. What brings you in?
I'm just here for an annual assessment.
Alrighty, we'll go over an assessment for your neurological exam, cardiac and respiratory, and an abdominal assessment, okay?
Okay.
Alrighty, can you tell me your name and date of birth?
Samantha Morrow, 11/9/90.
Good. And do you know what today's date is?
April 5th, 2018.
Perfect. How about who's the president?
Donald Trump.
Okay. Looks like you already had an eye exam. Your vision's 20/20, so that's good. I'm just going to assess your pupillary reaction. So if you could just look straight ahead at me. Good. Alrighty, now if you could just follow my finger with just your eyes. Good. Now smile. Puff out your cheeks. Good. Raise your eyebrows. Stick out your tongue. And normally now I would assess for gag reflex. Excuse me. Alrighty, I have a few objects. I want you to just close your eyes. Tell me if you feel sharp, dull, or soft.
Okay. Soft.
Good.
Soft.
Good.
Dull. Dull.
Okay.
Sharp. Sharp.
Good. Alrighty, now I'm going to check your shoulder and neck strength, okay? So if you could just shrug your shoulders against my hands and push your head against my hand and on this side. Good. Now you could squeeze my fingers. Alright, and if you could just sit back for just a second. Alrighty. Go ahead with your feet and push up against my hands and push down. Alrighty. If you could come back to the end of the bed. Now take your finger from the outside and bring it to your nose. Good. Good. Alrighty. Now I want you to take one heel, bring it to your opposite knee, and run it down your shin, and then do it with the other leg. Alrighty. Now I just want you to stand up, take a few steps for me. Now while you're still standing, if you could put your hands out in front of you, put your palms up, close your eyes, and I'm going to just assess for any drift. Good. Alrighty, now you can sit down and kind of like what we did with your face, I'm going to test the sensation in your arms and legs, okay?
Okay.
Alright, close your eyes for me.
Soft. Soft.
Good.
Dull. Dull.
Good.
Sharp. Sharp.
Okay.
Sharp. Sharp. Dull. Dull. Soft. Soft.
Alrighty, you can open your eyes. You can put both of your hands out. I'm going to place a few objects in your hands and you just tell me what it feels like, okay?
Okay.
Close your eyes.
A paperclip.
Good.
A coin.
Good. Alrighty, and that concludes your neurological exam, okay?
Okay.
So now we're going to proceed with your cardiac and respiratory assessment, okay? We already did a set of vitals. Everything looks within normal limits. Any chest pain?
No.
Shortness of breath?
No.
Any heart palpitations?
No.
Are you a smoker?
No.
Okay, have you gotten your flu vaccine this
Yes.
season? Good. Alrighty, so normally we would have the patient exposed in a normal clinical setting. For now, I'm just going to look for symmetry in your chest. When you feel my hands touch your back, just take a nice deep breath, okay?
Okay.
Alright. Nice symmetrical. Alrighty, so while I'm back here, every time you feel my hands touch you, just say the number 99, okay?
99. 99. 99.
Okay, I'm going to come around to the front.
99. 99.
Alright, so now you're going to feel some light tapping, okay? I'm just going to percuss. Back here, I'm just going to take a listen to your breath sounds, okay? Every time you feel my stethoscope, just take a nice deep breath. Good. All right, so now again, every time you feel my stethoscope, you're just going to say the number 99.
Okay. 99. 99.
Sorry, love.
99.
All right, and around the back here.
99. 99. 99. 99. 99. 99. 99. 99.
All right, so now we're going to move on to your cardiac, okay? Just going to take a look at your hands and feet for capillary refill and any edema, okay? Okay. All right, no swelling or edema, capillary refills all less than 3 seconds, so that all looks good. Excuse me. Alrighty, so now I'm just going to palpate your carotid and the rest of your pulses, okay? Okay, your brachial. Good, and your popliteal. And your PT. And your penile. All right, if you can just lay back for me. Just gonna palpate your femoral arteries. And now we're gonna palpate your PMI. So we're gonna go midclavicular fifth intercostal space. Good, and if you could turn towards me. All right, and if you'd like to lay back, I'm just gonna listen to your heart sounds, okay? Good, no extra heart sounds or murmurs. I'm just gonna take a listen to your abdominal aorta. And your renal arteries. And your iliac. And your femoral arteries. Good. Alrighty, you can sit up for me. Your cardiac exam looks good, so there's no need for any EKG or extra testing, okay? So that'll conclude your cardiac and respiratory assessment.
Okay.
Alright, so now we're going to move over to your abdominal assessment, okay? Are you experiencing any pain or tenderness?
No.
Any nausea, vomiting, diarrhea?
No.
Okay. Last bowel movement?
This morning.
Okay. If you want to lay down for me. Good. And expose your belly for me. Alright, I'm just inspecting her abdomen. There's no abnormal visible masses. Abdomen's nice and flat. Alright, now I'm just going to take a listen, okay? Take a listen in all 4 quadrants here. Good, nice normal active bowel sounds. Now I'm gonna, you're gonna feel some light tapping, okay? If you're experiencing any pain, just let me know. All right, timpani heard throughout your abdomen. Now I'm going to percuss your spleen. All right, dullness heard over that, and then we're going to percuss to feel the span of your liver, okay? All right, and that's within normal limits there. Now I'm just going to palpate. You're going to feel me lightly push on your abdomen, okay? If you're experiencing any pain, let me know. Good, nice, soft, non-tender, right? Okay, now I'm going to palpate for your spleen, which shouldn't be palpable. All right, and palpate for your liver. Okay, no pain? Now you're gonna feel me touch a little bit harder, okay? All right, no masses or abnormal findings. If you'd like to sit up, you're just gonna feel me tap on your back. Let me know if you feel any pain, okay?
Okay.
Good?
Yep.
All right, so no CVA tenderness. And that'll conclude your exam for today.
Okay, great.
All right, so now we're going to talk about a few topics that cannot necessarily be videoed. We're going to talk about the male genital exam, prostate exam, and rectal exam. So initially for all of these exams, it can be very uncomfortable for you and the patient. So you want to make everything feel comfortable, explain yourself thoroughly, make sure the patient's covered appropriately at times, and just making you and yourself know that there's an open and direct explanation for everything that's going to be performed on the patient. So with the male genital exam, you just want to explain the need for the information. You're going to be asking them some awkward questions. You do need to know about sexual history, relationship status, sexual preference, whether they're lesbian, bisexual. You also want to know number of partners. That can be really informative as far as sexually transmitted disease screenings. You just want to let the patient know that all this is going to be confidential, so that they do feel comfortable expressing to you any concerns that they may have. So in the beginning, you just want to kind of go over like a focus assessment, ask them, discuss about libido. Oftentimes, men can lack libido from a lot of psychogenic causes like depression or endocrine dysfunction or even side effects from medications. They can also experience erectile dysfunction, which can also be affected by those psychogenic causes, as well as decreased testosterone or diabetes. They can also have a lack or reduced ejaculation, sometimes caused by medications, surgeries, inflammation, neurological defects, or a lack of androgen. So you just want to kind of get like a focus assessment, making sure that you're asking them any concerns that they have, anything that they've noticed recently, and then following through with your physical assessment. So as far as your physical assessment for the male genital, you want to make sure they're draped appropriately, again, explaining everything that you're going to be doing. You want to inspect the penis, so inspect the skin, the foreskin, whether they're circumcised or uncircumcised, and retract the foreskin back. At times they may have like a cheese-like substance, which can be referred to as smegma, and just letting them know that that's kind of completely normal, but just reiterating good health, good hygiene. Next, you want to inspect the glands for any inflammation. A lot of times with inflammation, there can be compressed glands. So you want to compress the gland to open the ureteral meatus and allow for any discharge inspection. Any abnormal discharge at that time, as far as yellow, can be indicative of gonorrhea, or a white can be a non gonococcal urethritis, which is oftentimes from chlamydia. And any of those and any concern for any type of abnormal discharge can always be given a definitive diagnosis by a gram stain or culture taken. Next, you're going to palpate the penis, palpating the shaft with your thumb and your 2 forefingers, noting any induration or tenderness. Excuse me. Any abnormal induration can be urethral stricture or possibly carcinoma. Any tenderness also with induration can mainly be from the inflammation in that area. Next, you're going to inspect the scrotum, making sure you're lifting the scrotum, getting a good view. A lot of times mainly abnormalities that you will see can be dome-shaped white or yellow papules that are indicative of or noted to be epidermoid cyst. Also, things that you can see are undescended testes, swelling, which can be inguinal hernias, hydrocele, scleroderma, sometimes but rarely cancer. Then you move on to palpating each testes and the epididymis, which is the superior posterior surface of each testis. Normally, these are nodule and cord-like, so you just want to make sure that you don't falsely diagnose with any sort of testicular cancer, because they do normally feel this way. Each time, then you want to palpate each spermatic cord, including the vas deferens, which is the epididymis, to the superficial inguinal ring. Abnormal findings during this palpation can include varicocele of the spermatic cord, which refers to varicose veins of the spermatic cord, oftentimes found on the left. Usually feels like a soft bag of worms, where you want to separate it from the testes and slowly, where it separates from the testes and slowly collapses when the scrotum's elevated, when the patient's in a supine position. A lot of times this can mean that the patient, or a lot of times you can associate this with infertility. Another abnormality of the spermatic cord would be torsion of the spermatic cord, which is twisting. It produces acute, painful, tender, swollen glands or organ that is often retracted upward into the scrotum. The scrotum becomes very red and edematous, and it's oftentimes a surgical emergency. A lot of other abnormalities can be seen in the male genitalia, so you just want to make sure that the patients are performing monthly self-testicular exams, that they are aware of any abnormalities, and do feel comfortable coming back to you and discussing any of those abnormalities. Next, we are going to move on to the rectal exam. Excuse me. So for this exam, again, you just want to make the patient feel as comfortable as they can. They are not used to themselves even assessing this area. So just making them feel comfortable, making sure they are covered when appropriate, and explaining everything that you are doing. So you can either ask the patient to stand and lean forward over top of a table with their legs and hips flexed. Oftentimes this can be uncomfortable for them, so you can have them laying left side lying, and that'll give you just enough view for assessment as you need as well. Making sure that you do hand hygiene and gloves are on at all times. You want to spread the buttocks so that you can inspect for any lumps, ulcers, inflammation, rashes, or excoriation. A lot of times, patients are not aware of any of these. So you want to examine the anus and the rectum. Ask the patient to strain down, noting any lesions. They may feel like they are going to defecate at this time, but just ensure them that they most likely will not. Sometimes lesions in the anal rectal area can include hemorrhoids, venereal warts, herpes, and sometimes carcinomas or abscesses. So with a gloved hand and lubrication, as the sphincter relaxes, gently insert your fingertip into the anal canal in the direction upwards toward the umbilicus. You want to wait for the sphincter to relax. A lot of times it's a very nerve-wracking situation, so people will tend to be tense. You don't want to be forceful in any way. Also, not if there's any pain, you don't want to be forceful. You want to assess for induration, which can at times be from inflammation, scarring, or malignancy. Assess for any tenderness. So at this point, then you are going to insert your finger into the rectum as far as possible, which can be very uncomfortable for the patient. So again, just explaining what you're doing, rotating your finger completely from the right all the way around to the left to palpate most of the rectal surface as possible. Looking for any irregular borders that may be indicative of any fistulas or fissures, or indicative of any rectal cancer. So while inserted into the male rectum, you then can proceed to rotate your hand further counterclockwise to then examine the posterior surface of the prostate gland. Just make the patient aware that this may cause them or give them the urge to urinate. While palpating the prostate, you want to note size, shape, and consistency of the prostate, any nodules, or any tenderness. A normal prostate is normally rubbery and non-tender. Generally, some abnormalities can include prostatitis, which is just an inflammation from a bacterial infection. It can be acute, causing urgency, fever, those kind of acute bacterial infection symptoms, and the prostate may feel swollen, boggy. A lot of times from chronic issues of the prostatitis, it can be associated with recurrent urinary tract infections. Also, an abnormality can be benign prostate hyperplasia, which is just a non-malignant enlargement of the prostate. But again, causing, because of the inflammation, causing a lot of difficulties with urination because of the inflammation. So again, you're just going to want to gently remove your finger from the rectum, assessing if there's any stool on your glove, giving the patient something to wipe themselves down with, making sure you perform good hand hygiene, and then sitting back and discussing any abnormal or regular findings for the patient. As far as the prostate, you do want to just assess the patient for risk factors for prostate cancer, or anyone greater than 50 years of age. It oftentimes occurs more so in African American men than white men. Any family history, a first relative can make a patient 2 to 3 times more likely of having prostate cancer. And then also some studies do show that diet high in saturated fats from dairy and animal sources can be suggestive of risk factors for prostate cancer. If there are any risk factors, as well as any abnormal prostate findings during your exam, you may want to send the patient for some blood work for a prostate-specific antigen or for a digital rectal exam and follow-ups. So that concludes pretty much our male genitalia, prostate, and rectal exam.